Armodafinil is a stimulant used to improve wakefulness in adult patients with excessive sleepiness associated with obstructive sleep apnea, narcolepsy, or shift work disorder. In this video, let's find found. What is Armodafinil? What is Armodafinil used for? Contraindication. What are the side effects of taking Armodafinil? How does Armodafinil work? How to use Armodafinil? What is Armodafinil? Armodafinil is the enantiopure compound of the eudoroic modafinil. It consists of only the enantiomer of the racemic modafinil. Armodafinil is produced by the pharmaceutical company Cephalon Incorporated and was approved by the U.S. Food and Drug Administration in June 2007. Armodafinil is a stimulant used to improve wakefulness in adult patients with excessive sleepiness associated with obstructive sleep apnea, narcolepsy, or shift work disorder. In this video, let's find found. What is Armodafinil? What is Armodafinil used for? Contraindication. What are the side effects of taking Armodafinil? How does Armodafinil work? How to use Armodafinil? Contraindication. Armodafinil is contraindicated in people with known hypersensitivity to modafinil or its inactive ingredients. Side effects: headache, nausea, diarrhea, upset stomach, dry mouth, anxiety, nervousness, dizziness, and difficulty sleeping, insomnia. Pharmacodynamic. Armodafinil has wake-promoting action similar to sympathomimetic agents, including amphetamine and methylphenidate, although its pharmacologic profile is not identical to that of the sympathomimetic amines. Armodafinil is an indirect dopamine receptor agonist. It binds in vitro to the dopamine transporter, DAT, and inhibits dopamine reuptake. In addition to its wake-promoting effects and ability to increase locomotor activity in animals, according to Nuvigil prescribing information from manufacturer Cephalon, Armodafinil produces psychoactive and euphoric effects, alterations in mood, perception, thinking, and feelings typical of other central nervous system, CNS, stimulants in humans. Mechanism of action. Nuvigil, Armodafinil, is a single isomer of modafinil. The exact mechanism of action is unknown. Armodafinil belongs to a class of drugs known as eudoroics, which are stimulants that provide long-lasting mental arousal. Pharmacologically, Armodafinil does not bind to or inhibit several receptors and enzymes potentially relevant for sleep-wake regulation. Armodafinil is not a direct or indirect-acting dopamine receptor agonist. However, in vitro, both Armodafinil and modafinil bind to the dopamine transporter and inhibit dopamine reuptake. Half-life. Terminal half-life is approximately 15 hours. Dose. Obstructive sleep apnea. Indicated to improve wakefulness in adults with excessive sleepiness associated with obstructive sleep apnea, OSA. 150 mg POQAM. Doses up to 250 mg per day, given as a single dose, have been well tolerated, but there is no consistent evidence that this dose confers additional benefit beyond that of the 150 mg per day dose. Narcolepsy. Indicated to improve wakefulness in adults with excessive sleepiness associated with narcolepsy. 150 to 250 mg POQAM. Shift work sleep disorder. 150 mg PO as a single dose 1 hour before patient's work shift. Safety advice. During pregnancy, the FDA classifies Armodafinil as a Category C drug. This means that it may be unsafe during pregnancy, but there's not enough clear evidence to definitively say it is safe. There is an additional issue to consider with regard to Armodafinil and pregnancy. That's all the information about Armodafinil we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.